these things, and they turned around and were delivering boxes with volumes more than what anybody actually asked for of
Wow.
food and necessities and soaps and treats and candies. And it was really, it's still going, but it was
Wow.
really a beautiful thing to see come together.
Yeah, that's awesome. I think we're going. Hey, Cody, how's it going?
Not too bad, Brett. How are you?
Doing pretty good. Saw you guys out there today via social media. You were what, at a nursing home resident, 100 years old, wishing him a happy birthday?
Yeah, so we had the opportunity to slide over to the landing of Brighton, which is one of our assisted living facilities in town here. And we know of a resident over there who's a World War II veteran who's today is his 100th birthday. And unfortunately, with everything going on with COVID-19, there's not much of an opportunity to celebrate his birthday. So we took a look at it and said, how can we, take this, make it an opportunity, give back to the gentleman a little bit. We certainly owe him for the part that he's done in his life. And we were able to get over there with our crews that were on duty, make up some cards, make up some signage, and give him from the courtyard at a safe distance, happy birthday wish and song, and really kind of brighten the gentleman's day. So
yeah, that's awesome. Seeing a lot of those floating around social media, but nationally, but to have somebody locally do it, especially coming from you guys. And maybe backtrack a little bit. I didn't actually introduce you to the podcast or the audience. So Cody is the the chief of Brighton Volunteer Ambulance, and you've been chief for what, about 3 years now?
I started with Brighton Volunteer Ambulance in January of 2016, so a little over 4 now.
Okay, nice. And then before that, you were over at Brockport, right?
Correct. I was the chief of Brockport Ambulance for about 2 years before coming over here. Got my start out at Brockport, came up through the chain there, and kind of learned the ropes and grew with that agency, and then expanded out.
Oh, that's awesome. So, you and I sort of go back a ways, going to high school together, and then even, doing some business together when I was working in the IT industry. So we've sort of kept in touch over the years, and I've followed your path and your career, and see where you've gone and been, and it's been impressive. I saw on Brighton's website that Brockport won an award right back in 2014 while you were chief there.
Yeah, so in 2014, every year the region that we work in, so there's a governing body for emergency medical services in the county. It's the Monroe-Livingston EMS region. That's part of the state EMS hierarchy on how everything's managed. They do awards every year, and Brockport Ambulance was awarded Agency of the Year in 2014. That was a time when we were kind of coming out from being a part of the fire department. We had separated off to be our own entity at that point. And really, it probably had one of our best years in quite a long time. So
that's great.
We were lucky enough to be acknowledged there.
Yeah. So circling back to present day in coronavirus and everything going on, what are some obstacles that you're seeing from an ambulance standpoint, EMS standpoint? Is it less busy because people are sort of afraid to be out and about and they're hesitant in calling, or I guess just in general, what are you seeing as far as EMS goes?
Well, I think it's kind of a little bit of everything. Since probably the second week of March is when we really started to see it here in Monroe County. We've seen high volume days, very low volume days. I know of an agency that had 0 calls in an entire 24-hour period, who typically does 15 calls or something like that. For Brighton Ambulance specifically, our volume's down almost 25%, which is good and bad, depending on which way you're looking at it. From the from the perspective of public health, I think that it's good, because to me that's indicative that folks are actually taking the stay-at-home Monroe, social distancing, so on and so forth. They're taking all of that seriously.
Right.
They're not coming out. They're not going to the store. They're not getting in accidents. They're not, going to the doctor's offices for elective procedures.
Mm-hmm.
All those things are important, as we look towards moving the economy forward. But for us at Brighton Ambulance, that's tough, because our revenue comes directly from our work.
Sure.
Unlike a fire district or a police department, we're not entirely tax funded. In fact, our tax funding is very minimal here in Brighton. We only receive a very small portion of our budget is actual tax funding, and that helps us purchase ambulances. As well as for Brighton residents, it works like a copay so that they don't have any out-of-pocket remainder if they are taken to the hospital.
Okay.
But for the better bulk of our revenue, 25% reduction in call volume is a 25% reduction in revenue.
Sure.
Given we're blessed that we can continue to work throughout this, because we are deemed an essential entity. So luckily for our staff, we're able to keep our folks on the road, keep them working. They do have some, paycheck security in that regard.
That's good. Yeah. Have you had to limit hours or anything with employees, or has it pretty much been status quo, business as usual?
So that's something we took a look at early on, and we didn't want to do too much of a reactionary approach to that. So we kept things status quo. We didn't reduce any hours. The one step that we did take, though, is we gave our folks an option. Our schedule consists of, during the daytime, three trucks that are full-time employees, and then one truck that is composed of part-time employees.
Okay.
In the evening, we have we have 3 ambulances in the evening. One is full-time, one is part-time, and one starts a little later, and that's another full-time shift. What we did with those part-time hours is we gave folks the opportunity, if they wanted to voluntarily step back from being on the schedule. Maybe they wanted more time at home. Maybe they wanted to, reduce their exposure potential to COVID. And we use that as a little bit of a catalyst to, protect our payroll output, all while helping our staff at the same time.
Sure. So what have you done? Has there been any precautions as far as staff goes? The people who are working and are full time, has there been any extra precautions, or do you guys? I'm assuming you as an EMS organization already take health and safety precautions, but anything additional as of late?
Oh, endless almost. I've got a very strong operations staff, our management team here, and I feel like we got a little bit ahead of this. We have a very strong exposure control plan, which goes through our day-to-day, whether there's COVID or not. And that helps us make sure that, we're properly disinfecting surfaces. We're taking the proper practices to protect our patients from, anything from, infection associated with care, making sure that there is no carryover. And of course, we protect our staff. So having that robust program, we're able to just kind of ramp it up to take care of COVID at the same time. You see everybody out there these days in face coverings. For us, it's surgical masks, it's N95s, it's goggles, although I just have my regular glasses on right now, and I'm in my private office, so I don't have a mask on. So
sure.
When we go out, we follow that properly. Yeah. And in gowns for certain circumstances to help protect the staff from the COVID. And at the same time, for every step that we take to protect ourselves, we're protecting the public too, because we're not getting anything on our uniforms. We're not, in those occurrences where we know that we're in the presence of a positive COVID patient. Everything that we put on, we're able to take back off and discard safely so that we're not carrying it onto our next patient, back here to our colleagues, onto or home to our families, etc. And that's only about probably 1/10 of what we've done.
Sure. Yeah. We sort of opened the discussion with, how your organization went out and, reached out to the gentleman, World War II vet, wished him a happy birthday. Have you guys seen anything else in the community, as far as positivity? This thing is obviously negative overall, but there tends to be, at least a little bit of positivity that comes through it, some community effort, behind it. Have you guys noticed or done anything in that regard?
Absolutely. I think the amount of humanity that comes out of something like this is really kind of always eye-opening. We've had any number of things between, I think in the last week, our crews have not had to feed themselves because of the number of donations. Just last night, we had a nice family in our community here donate something from Phillips European. And within an hour after that, our insurance broker dropped off a whole thing of Moe's for our crews to have dinner. So anything from, small or large donations like that up to, we had one of the doctors from Strong Hospital lives in our district here in Brighton, and wanted to, openly show that they're supporting and appreciative of us. So there's a company in Penfield called Card My Yard, which is kind of a growing known thing. And they did a nice thank you to our EMS heroes display in our front yard here. Brighton was lucky enough to be the first ambulance agency that had that. And then they progressively moved that around to other ambulance agencies in the county. And again, like I said, with the PPE, personal protective equipment, that's probably only 1/10 of what we've experienced. So
Sure. Yeah, it's nice to hear things like that. Like I said, this whole thing in general is negative, but there's definitely some positives that can come out of it. And one thing that I've been hearing a lot of lately is that this whole thing is kind of reminding people not to take the people and the things and the services around them for granted, and to appreciate those such as yourself and in your organization that go out there, and even outside of COVID times, whatever you want to call this, that go out there and really do put themselves, right in the middle of the thick of things. And so it's unfortunate that sometimes it takes something like this to appreciate the people that do those services for us. But it's at least nice to see that people are taking the initiative to do it. And I'm sure for your staff, it's certainly a boost of morale, to give them an injection of hope.
Absolutely. And, I think even your four-legged friends there are passing on their appreciation.
Yeah.
Don't get me wrong. If I was doing this from my home office, we'd be hearing the same thing on my end. So,
yeah.
But yeah, it's kind of, it's hard to relate because, this is an infection, but you see it start to bring back memories of how kind of America, circled the wagons and rebuilt after something like 9/11. I mean, you and I were young at that point, and so we didn't see it from the perspective of folks that are in our positions nowadays. But I think there's a lot of similarity to that, and ultimately, what comes out of something like this, I think, is opportunity. You talked about recognition. A lot of the time, we really try to focus in Brighton on our community. That's one of our primary, phrases. This is our community. We're here to protect our community. And for that matter, it doesn't matter if somebody's coming on in a police car, in a fire truck, in an ambulance. This is one effort to protect a community. And I speak for Brighton, but any chief of any other EMS agency in Monroe County is going to have the same thing to say. We come as a team. We find the ways to work together and build up the community. And I think the nice and the unique thing is when we get into situations like COVID, is that stays, but at the same time it reverses too, because the community works to build us up, which is nice. And it certainly helps because, as our providers here at BVA are out, and you see in healthcare the nurse posts where they're wearing their masks, they're wearing their PPE all day. Thankfully, we're able to get a little bit of a reprieve from that. But even at one quarter of the amount of time that you're wearing that PPE, it's still tough on our folks. When we arrive to a call, it takes a little bit of time to get all properly geared up, to put goggles on, for the ladies to put their hair up, to put our gowns on, to put our masks on, to double glove, and then you got to go into a known environment that is, potentially rampant with COVID. And, that is a big step that our folks are taking, for the greater good. it's so admirable. I don't do a lot of the work these days. I get out on the road when there's a hole. I get out when it's needed. But all in all, there are some folks that are just really doing amazing work for us. So.
Yeah, and then too, maybe I don't know exactly how the organizational structure works, but do you have non-paid EMS workers that are strictly just volunteer?
Yeah, so Brighton Volunteer Ambulance is what we call a combination agency. So that means that we have paid and volunteer staff. Our board is made up entirely of a volunteer staff. It's a 7-person board of directors right now, and those folks work on the road. They work on some are just in support roles, but I would say better than 90% of our volunteers are all active road providers.
Wow.
We have about 70 folks on staff here, and probably 25% of those are volunteer providers. So we've actually got a really nice mix.
Yeah. So, I mean, not to mention the fact that paid employees are on the front lines, and that's obviously certainly admirable, but the fact that you have volunteers that aren't getting paid, volunteering their time and efforts, even in a time like this, that's so impressive.
Yeah, 100%. As we kind of did our planning and preparation for how Brighton Ambulance is going to respond to COVID, we looked at a number of factors. There are advisories and precautions of at-risk population and so on and so forth. And, we took all of that into account and wanted to say, if there's something going on right now related to COVID that you're not comfortable working in, you don't have to work right now. It's a no questions asked scenario.
That's nice.
It was tough initially because we have a number of college students that are on our volunteer staff too that all got shipped away. They couldn't stay at the U of R. They couldn't stay at RIT. So that was something that we had to look at from the personnel aspect. As well as just some of our paid folks that may be part-time for us, but they're a firefighter somewhere else and they have a family at home, and just that level of exposure wasn't really 100% right for them right now. And that was something that we had to, take in stride and understand and support as much as we could. And we were able to accommodate those folks, which is important. So.
Yeah, and that's important. We talk about what precautions that organizations as a whole, medical or not, are taking, but the treatment of employees, right? The expectation that's put on employees. You think about some essential workforces that I'd have to think that unfortunately there are some organizations that aren't as caring about their employees, and they'll probably just be doing the bare minimum as far as what the law says or what the CDC guidelines are. But to actually go above and beyond and say, hey, if you don't feel comfortable performing these duties, it's no questions asked, like you said. I think that shows the care and treatment of employees and volunteers. Actions speak louder than words, I guess, is what I'm trying to get at.
Yeah, I completely agree. And, that was one of the things that we looked at as a management team, both the operations staff and the board of directors here, very early on was, not only what are we going to do for folks that, are essentially being displaced in the essence of our college students. They're being displaced from their college and sent home.
Yeah.
What are we going to do for them? How are we going to understand and help them? What are we going to do for our providers that are part-timers here and have full-time other essential jobs? How are we going to work with that and support them? And then for our full-timers, which, they're clutch. They're the folks that are here over 40 hours a week in and week out. We work primarily 36 hours one week, 48 the next. And that adds up real quick in this, regular environment, let alone in working in COVID. So how can you best take care of those folks? So one of the things, you spoke to going above and beyond as much as we can. One of the things we decided to do early is if folks do become symptomatic. So symptomatic of COVID is sore throat, respiratory issues, have a fever, something like that. Doesn't necessarily mean that they have coronavirus, but it it means that they may be developing something, and we have to take that very seriously.
Sure.
So we decided very early on that if you're symptomatic, you can stay home from work. You're going to be paid the hours that you would have worked, but it's not going to come out of your paid time off pay.
That's great.
Yeah, so that was just one of the early on steps that we took. We talked earlier about how the environment has changed a little bit around Brighton Ambulance. I think we are probably one of the first agencies to institute temperature monitoring. When you come in the door, when you report for work, you can only come in one door right now. You have to come in, sign in, declare that you're not symptomatic, take your temperature, record it. And then to build on that, we not only did pre-shift screening, but we do pre, mid, and post-shift screening. As the understanding of coronavirus evolved, it seemed that to strike a temperature was probably going to be one of the earliest indicators that somebody may be developing something. So not only just that pre-shift screen, but we instituted mid and post-shift screening. Probably 3 weeks into everything, we instituted universal masking. So while we're at work, even if we're not on a call, we're wearing surgical masks or homemade masks, whatever we have available to us. And that's more of not so much to protect me, but it's to protect you from me. If I'm a carrier and I don't know it, and I can give something to you. So by putting that mask on, it helps protect you. It helps protect our colleagues and ultimately our family and our communities.
Yeah. And, as you're speaking, I'm thinking about there's all these physical precautions, right? And these physical things that we can do to prevent the spread and prevent, monetarily, do things to help the cause, so to speak. But I think one thing a lot of people may miss in conversation is peace of mind. With people quarantined and a lot of people out of jobs, or at least furloughed right now, I think organizations such as yourself that are doing things to alleviate people's minds and anxiety over the situation is equally as important. And I think that's, like I said, sort of, we can focus so much on the task itself, which obviously is important and needs to be done, but we tend to forget about the mental health side of things for employees and for members in the community too.
Right. And, mental health is one of our biggest focuses here. I'm actually a member of the Monroe County Peer Support Team. And typically what the peer support team does is if there's a bad call, or somebody's struggling with something, I'm not a counselor, but I'm able to go out and facilitate a discussion. Or if it's not a discussion, we're able to put people in touch with the right resources. And the nice thing about being a part of that team as well is being able to bring that back to Brighton Ambulance. And that's one of our primary focuses is our staff's health and wellness and their mental health. And one of the, to mental health, one of the things that we saw early on, you remember when this really first got going, there was a huge rush on the supermarkets.
Right.
And an early issue that was identified was childcare and availability of necessities. That's a call going out right now, so I make my own notes too. We'll let it talk for a second.
1900 South Clinton Avenue. Email setter.
There we go. That's our BRICS station monitoring system, which is really a neat little thing. It integrates our building with our phones, with our iPads and our computers, and it gives you all the information and mapping to calls and everything. So it's really a neat little system. But
great.
What I was saying, we identified that folks needed childcare because some of the daycares were closing early. We were able to kind of crowdsource within EMS a system to help get folks childcare. That was not done through BVA. It's kind of done EMS as a community.
Okay.
And at the same time, one of our volunteers, Mark Cohen, is the Rochester Chamber of Commerce, Bob Duffy's chief of staff. He's one of our volunteers, and he put us in contact with a gentleman named Roy Allen who said, I want to give back during this. What can we do? And I actually wound up having a conversation with him at almost midnight one night, because he was so excited to get something going and help. And he said, "What can we do?" And we tossed around some ideas, and we came to, if you could help provide food and necessities, maybe it's toilet paper, maybe it's just, gosh, who knows what it is.
Sure.
Somebody that can source and help folks source that, because when you're on a 12-hour shift, if Wegmans opens at 7 o'clock and you work from 6 a.m. to 6 p.m., they're out of toilet paper by 8 o'clock in the morning.
Yeah.
And what we were able to do as a company is actually put up a request form on our website, on our public-facing website, so that EMS providers across the county, it didn't matter if you were the Brighton Ambulance, Gates Ambulance, Webster Ambulance, it didn't matter where you were coming from. You could go log in there. It was password protected so that we didn't get too much not community, but intrusion and spam and so on and so forth. But you could go in there, fill out what you need, and that sent an email to Mr. Allen, who put his team of folks who were out of work from his normal industry into sourcing these things. And they turned around and were delivering boxes with volumes more than what anybody actually asked for, of food and necessities and soaps and treats and candies. And it was really, it's still going, but it was really a beautiful thing to see come together.
Yeah, that's awesome.
That speaks to the community. That speaks to really everything of how pandemic situations like this can bring out the best in people at the same time.
That's great. And that you said that form was on your website?
Yeah. Yep. We were able to put that up right through our website. It is just for EMS providers to access.
Yeah.
But as we put that out, we shared that password with the chiefs of the other agencies and encouraged them to share it with their staff. It's very clear. This isn't a Brighton Ambulance program. This isn't a Cody Dean program.
Sure.
This is, we were lucky enough. I was lucky enough to be connected with this gentleman who wanted to give back, and we were able to, host that essentially through our website, so that so it was easily accessed. One of the big things that I think limits any business, any industry, anything, even healthcare, is access. Access is always the problem. Access to education, access to healthcare, access to resources. So just being able to be the tool to do that, gave us a lot of satisfaction.
Yeah, that's great. And you touched a little bit there when the call came through on technology. Maybe you can go speak a little bit to what Brighton Ambulance has done as far as technological advances and how technology helps you perform the EMS duties.
I will tell you, I am the last person to talk tech. You know this, Brett. I am by and far the last person to talk tech to. But, some of the things we do, we have a great relationship with our IT company who keeps us up. I actually had to tell my computer not to reboot while we were in the middle of this conversation.
Updates.
Yeah. Yep. So, we have probably 25 computers across Brighton Ambulance between the business administration, operations, crew charting, dispatch, and then we even get out into the field. We have iPads in each of our vehicles, which integrate with the BRICS program that I mentioned when that call was coming in. The Philips Hue lighting just went off behind me. I don't know if you saw that light up blue.
Did. Yeah.
So there's visual, there's audio clues there. And we just try to keep everything as integrated as we can. And really, I think the biggest two tools we have is the Google Suite and the BRICS program. Because everywhere I go, whether I'm sitting at my desktop, whether I'm on my phone, whether I'm on my iPad in my truck, or even in an ambulance, I have the same access to everything through mostly one login. For all of our business stuff is done through Google. All of our response monitoring and reception of calls is done through BRICS, and they're all right next to each other on the devices, whether it be on a desktop with BRICS, desktop with the Google Suite, or a phone or an iPad, or gosh, I'm sure there's probably other things we could get into. But there's more we can do. We're currently looking into Sierra devices to improve our connectivity in the ambulances. Right now, the county's working on updating the computer-aided dispatch system at the 911 center, which would actually give us a higher level of connection to the county in the ambulances and be able to mark our responses and talk right back to the county. Rather than talking on the radio, we can click a button on the screen and say we're en route, we're on scene,
Oh, wow.
reporting to a hospital. And that's something that's been available, but they're trying to bring us into the 21st century with a new CAD that is, flexible, light, easily updated compared to the current system they're on. So
Sure.
as well established as we are right now, there's a lot more coming in the future.
Great. So, yeah, I guess in wrapping up, you guys are like you said, not fully funded, as some other entities are, such as the police and fire department. So, if anybody's interested in, donating and helping out Brighton Volunteer Ambulance, how do they go about doing so?
So, first, we're fully funded. We're just funded differently, right?
Sure. Yep.
So a police department, a fire department, that's entirely tax-based money. Our income is, over 90% based on what we call third-party billing. If I were to come and take you to the hospital, Brett, as a company, I would bill your insurance company. If you're a Brighton resident, anything that's left over is covered by the tax district. Okay, so there's no out-of-pocket expenses to you. That's where we get the bulk, over 90% of our income. So it's not a singular amount that we may or may not use, we may or may not need. It's based on our actual responses.
Sure.
But at the same time, as we said at the beginning, that makes it tough too, because right now when we have, we're a company that's built to do well over 6,500 calls a year. In the last 2 months, nearly 2 months now since COVID started, our call volume's down 25%. That's significant. That means that we've got to make some serious changes to the way we look at some of, the way some of our expense lines are. But as far as helping us moving forward, you can visit our website. I know you had it up there just a little bit ago, brightonambulance.org. There is an option to donate there. Residents of the town of Brighton receive 2 times a year an appeal for our spring and fall fund drive, and really anything from $5 on up to what can be given is what makes a difference. We're really no different than any other nonprofit in that regard. Anything that we take in above and beyond our what we need to operate, all that does is it goes back into our staff. It goes back into volunteer incentives to keep people encouraged in volunteering. It goes back into our equipment. There's, at the end of the day, the only thing that's left over is enough to just be able to make sure we can get through times like right now.
Yeah.
There certainly is no massive nest egg.
No, I think it's really important. Going back to the whole taking things for granted, you don't really think about a service like this until you need it. And unfortunately, like at a time like this, there's certainly an increased need, for additional funding. So, yeah, if anybody is interested, go to brightonambulance.org. Cody, is awesome having you on. It was great catching up, and absolutely love what you and your organization there is doing, and just keep up the good work.
Thanks, Brett. I appreciate the time.
Yep. Take care.
Take care.